Hi guys, I'm Camellia. I am an APRN. I'm a practicing psychiatric mental health nurse practitioner, also known as a PMHNP, and I'm a nurse enthusiast and coach. And as I've done or endeavored to do over the last few weeks, I wanted to get on to briefly talk about a few facts related to the PMHNP role. This is for those of you who are considering advancing your degree and you want to just have some more information around the role itself. Or if you are a PMHNP student, it may help you in that area as well, just to have more information. Now, a lot of what I will share today it's just based on facts that can be found at the American Association of Nurse Practitioners, also known as AANP. By the way, this is not AANP, the board certification entity, but this is the American Association of Nurse Practitioners. And so there you can find lots of resources, lots of information related to nurse practitioners. And so what I usually try to do is stay sort of abreast of any changes of kind of where things are with the PMHNP role. And so I have done some just additional searching around the role itself, and the AANP has good information, basic information about updated information about the PMHNP role. So I'm just going to go through the 5 facts that you can find there, but I'm also going to relate it to my reality. And so, of course, that can look a little bit different depending on where you work, the state you practice in, where you are in your career as far as your experience. But I'm just going to share that and relate it to kind of what I'm seeing as well. So the first thing about, if you go to the AANP website, you can find information, the 5 facts. The first one talks about, I would classify this as demand, or the number of practicing certified PMHNPs. So currently I was interested to see that there's only 12,690 PMHNPs, so board certified mental health nurse practitioners globally. And so why is that important? Because that's a fairly small number. If we put that into perspective, 67% of all nurse practitioners are FNPs, which, you know, as an FNP, you can really globalize and you can expand to any specialty. I will tell you that currently you can practice in psychiatry in most areas as an FNP, if that's an area that you want to specialize in. So it's interesting because when we look at certifications or certified psychiatric mental health nurse practitioners, there's only 12,690, which is a very, very small percentage. It's also a small percentage when we talk about demand, the demand that we need to cover people and people that have mental health conditions or illness or just diagnosis. It's much more than that. And so you guys have probably heard and seen there's a shortage, in terms of providers, really, possibly in all areas, but we can really argue the fact that there is a need for more mental health providers. And so just seeing that only a small amount of people are actually certified as PMHNPs, I thought that was pretty interesting. And a lot of it doesn't take into account that some of the people that are practicing in mental health are actually FNPs, which, is great that you can do that. But that's one interesting fact. Number 2, one of the facts that you'll find there has to do with salary. So this is a question that I've gotten, not a lot, but I've gotten this question, from time to time from people that are actually interviewing for jobs, and they kind of want to know what's the average, what can you expect? And based on the AANP, the median total annual income is $131,500 a year. And I will tell you that, and I did some research specifically for North Carolina, and it's a little under that. So it's based on, this is where it matters with your state. It matters what facility, your type of facility you're working in. And that's important because some places you get paid based on your base pay plus a salary plus incentives. That's kind of what kind of factors into that. So it can be plus or minus, but that being the average. And the reason that's important is because, you know, as a specialty, you can expect a higher salary. So if you're certified in psychiatry and mental health, most places will pay you for that. And because it is a true specialty. So that's number two. Some people ask, you know, what can I expect? What's the starting average salary? But just know that globally, 131,000 is roughly kind of the mean or the average. And in North Carolina, it's a little lower. And that's just because of the geographical location, where nurses are essentially, they're paid less than they are in other states like California and New York. So the same applies as an advanced practice registered nurse as well. Number three, how many patients do you see in a day? This is a question I've gotten a lot. That depends. I did another video on the different places that you can work. All of those different places look different. They look different. So it's hard to say that, you know, you can expect X amount of patients per day. I can say on average, according to the AANP, by the way, 13 patients per day was what was reported as sort of an average. And how does that apply to me in real time? It's about right. You will see usually less patients when you're looking at things like the emergency department. But of course, some of that's based on staffing as well. I would say based on all of those places that I talked about that you can work as a PMHNP, outpatient is where you're going to see the most patients. So that just goes without saying because you're seeing patients throughout the day. They're usually scheduled sort of, you know, back to back, and you usually see more patients. So you do get incentivized and things like that based on where you work, based on how many patients you see. But that can get a little tricky. I mean, it can be pretty taxing to see, you know, more than, you know, usually about 15 to 16 patients per day. And so you want to consider that when you are thinking about where you want to work. So outpatient, you are going to just by nature see more patients. But the average, according to the AANP, is 13 patients per day, which is about average, and it's reasonable in the sense of being able to do it and to be able to sustain what you're doing. Number four, what's the most common practice setting? Again, this refers back to that video that I did on where can you work. The most common practice setting, according to the AANP, is in a psychiatric mental health facility. So that would fall into the acute care arena where you are seeing patients that are actually admitted for a mental health condition. The beauty of all of that is that there are so many other places outside of that. If that has not been your thing, maybe you are doing that as a registered nurse right now. You're on an acute floor working with patients at the bedside, and you've realized that, you know, there are some challenges. This is not a good fit for me. I'm saying this because I think it's important that you not rule out mental health based on your experience in an acute care facility, because things can look quite different if you're looking at that outside of that type of work. So that's the most common, but it isn't the only one. That's what I will say there. Number five is the top, what patients do you treat? The top conditions that were reported according to the AANP are depression, anxiety, insomnia, and dementia. So those are that's a pretty standard thing from what I see. Of course, you may see patients that have other co-occurring things going on, such as substance use disorders. But I will say, even from being in an outpatient facility, most of my PMHNP tenure thus far, most of those patients fall in this category of diagnosis, depression, anxiety, and insomnia. So That is really kind of just an idea. You're going to see more acute things going on when you work in the emergency department. You're going to see more acute things going on in an inpatient facility, but that just gives you an idea. I just wanted to cover this a little bit because, again, I try to stay on top of the changes that come about with PMHNPs. The good thing is that we have more and more people that are pursuing this route. But, I think it's important that you consider, whether it's really right for you. I'm not really here to endorse the role in terms of getting all these people on board that aren't doing what they really want to do and what they're passionate about. But this video was really just meant to help you to think about some other things and some factual information, as well as comparing that to kind of my real life as a PMHNP in practice now. I'm hopeful this was helpful to someone. And again, you guys have a great day.